Alrighty, well, welcome everybody. I can see we've got a good number of participants joining, so really happy to have everyone attending our second week of the Open Enrollment webinar series. We have with us today Danielle Burkett, so super glad to have her and very glad she's agreed to share her expertise with us all. So I'll go ahead and just give people a chance to filter in. I know we just opened up the webinar to join, so there might be a couple other folks running a little bit late. But yeah, just really happy to have everyone here. And I've got the list of questions that everyone had submitted from last week. Danielle had a chance to look over them, so hopefully we're going to be able to get those answered for y'all today. And yeah, just really excited to be bringing this content to you. Alrighty. So yeah, as we're getting started, I do just want to give a shout out again to Janssen Pharmaceuticals. We appreciate their support in making resources like this possible for us to bring to the PH community. Really means a lot for us. And Danielle, you can jump on to the next slide. So yeah, I'll just turn it right on over to Danielle and yeah, take it away.
Okay, thank you. Thanks, Jigger. Hello, everybody. My name is Danielle Burkett. I have been working with as a CMA for 8 years at Duke Pulmonary Vascular Disease Center. My primary job here is working with insurance companies to get my patients' PH medications approved. So some time ago, just a little background, my mother had gotten ill. I had to advocate for her care. That was when I realized working in the healthcare industry was my passion. I decided to change careers and go back to school to become a medical assistant. It has been my honor and pleasure to advocate for patients that need my assistance. So we're just going to go over today's goals really quickly. Today's goals are to help you understand a different part of Medicare, to learn important terms and policies, and to know where you can find resources.
All right, I'm going to pause just for a moment here. We got a comment from Diane that Danielle, your sound is fading in and out a little bit.
Okay.
So I don't know if you can like get closer to the mic, if that might help. But yeah, also thank you, Diane, for letting us know. And please, anyone, keep using the chat or the Q&A to give us a shout out if there are any problems.
Okay, I'll try this. I don't know if that might be better.
We'll find out. It was sounding okay to me. So, but yeah, please, everyone, let us know if you do.
Yes,
have trouble.
please do. I can always call in if I have to. I apologize. Okay. So what we're going to be doing next is we're going to be begin with a very simple explanation of the basics of Medicare. Again, it's just a very brief summary of each part. Part A is your inpatient care, any hospitalization. Part B is your outpatient care, your doctor visits. Part C is now known as Medicare Advantage. It's a supplementary plan, meaning you do have to pay out of pocket for that. And Part D is your prescription drug plan. And I'm going to be going into further detail about all of these next individually. So Medicare Part A. Medicare Part A helps pay for inpatient care in a hospital or limited time at a skilled nursing facility. That's usually following a hospital visit. Part A also pays for some home health care and hospice care. A couple of questions I get when people ask me about Part A is there a deductible for Part A? And yes, for 2022, the deductible right now is $1,556. It will go up next year. I don't know what it's going to be, but I do know that it will be going up as it usually does every year. The next question I get is, do I have to pay a premium for Part A? So 99% of Medicare beneficiaries do not have a Part A premium since they have at least 40 quarters or 10 years of Medicare covered employment. Meaning if you have worked and had the Medicare taxes taken out of your paycheck for over 10 years, then you will not need to pay a premium. So your Medicare taxes usually is combined with your Social Security benefits, and that's what I'm talking about. So if you've paid for over 10 years, or if you've worked for over 10 years and paid into Social Security, you will probably not have a premium. So Medicare Part B. Medicare Part B helps pay for services from doctors and other healthcare providers, outpatient care, home health care, excuse me, that was the wrong one, durable medical equipment such as your oxygen, and some preventive services. So somebody like a PH patient, you might be going to pulmonary rehab. That's going to help cover for your Medicare Part B, will cover for that. Just so you know, some of our pulmonary hypertension medications are covered under Part B. If your medicine requires you to use a pump or a nebulizer, it will be covered under that. A question I get when it comes to Medicare Part B is, do they also have an annual deductible? And yes, in 2022, the deductible is $233. After the deductible is made, you still have to pay 80%. 80% is still your excuse me. Medicare will pay 80%. I'm sorry, that's not true. You are responsible for 20% of your services, along with the PH medication that they may be covered under Part B. You pay 20%, they pay 80%. Sorry about that. Okay, so Medicare Part C is now known as the Medicare Advantage Plan. This program is part of the government's Medicare program, but they are offered and managed through approved private insurers. Medicare Advantage plans combine all Medicare benefits into one part, Part A, Part B, and often Part D coverage. Some of them even include dental and vision included with the parts with your Medicare Advantage plan. To enroll, went ahead on a second. To enroll in Medicare Advantage plan, you must already have original Medicare A and B coverage. And just so you know, there can be an additional cost, just like you would for Part D. So some people want to know, what does Medicare Advantage plan cover? Well, Plan C covers basic Medicare benefits, including hospitalization. It pays Part A co-insurance, plus coverage for 365 additional days after Medicare benefits end. For medical expenses, it pays Part B co-insurance, generally 20% of Medicare approved expenses, or co-payments for hospital outpatient services. A very important question I get is, if you have the Medicare Advantage plan, can you still have Medicare Part D? And the simple answer to that is no. If you sign up for Part D while you have an Advantage plan, you will then be unenrolled from Part C and go back to original Medicare. So if you have already purchased a Part C Medicare Advantage plan, know that you should make sure it has a pharmacy benefit to it, because if you don't, then you would have to get Part D, and then you would get kicked out of your C and have to go back to your original Medicare. I know it's confusing, but we'll talk more about that. And then finally, Medicare Part D. Like Medicare Advantage plan, this plan is part of the government's Medicare program, but they are offered and managed through private insurers, approved private insurers. If you are entitled to original Medicare Part A and or enrolled in Medicare Part B, there are two ways you can get Part D, prescription drug coverage. You can A, enroll in a separate or standalone Medicare Part D prescription drug plan, either when you turn 65 or during open enrollment, which is right now. Or you can join a Medicare Part C plan that includes drug coverage. But again, I state, remember, not all Medicare Advantage plans include drug coverage, so you want to make sure that when you are picking a Part C plan or an Advantage plan, make sure it does have drug coverage. Now, I know that was a very basic view, but we're just going to go over, we're going to take a quick pause right now and see if anyone has any questions for me. Jager, do we have any questions?
Yeah, we did have one question come in, which I did answer in the Q&A, but you can certainly also speak to it some more. The question is for the Part A premium that you're talking about, where you worked 10 years, they wanted to confirm that that means you don't have to pay that premium.
That is correct. You do not have to pay a premium if you've worked at least 10 years and gone into, and put it into Social Security. The only way that you wouldn't is if you didn't work. If you were a stay-at-home mom or stay-at-home parent, or you just didn't work, then you would definitely have a premium. But if you have worked at least 10 years, regardless of what time it was, it could have been before you if you're 50 and you only did it when you were in your 20s, then yes, as long as there's 10 years accumulated, you will not have to pay a premium.
All right, awesome. And I guess also just to clarify then, does that mean that there would still be a premium for Part B?
For Part B, let me just see real quick. Hold on a second. Was there Part B was your doctor's patients? Yes, you're always going to have to pay for Part B. Yes, I'm sorry.
Okay.
Yeah, that comes out of your. Usually, it comes out of your Social Security benefits. Well, Part B will come out of.
Gotcha. Okay, great. Thanks for
sorry.
clarifying.
Yes, sorry. Okay.
All right, and then we did have one more question come in from Pamela. Are there any penalties if you switch from an Advantage plan to a prescription drug plan?
That's a really good question, and I'm not very sure. I can look into it for you, and I know, Pamela, that we are going to be speaking again next week and the week after. We have a Q&A session. I don't really know right now off the top of my head, but I will definitely look into it for you, and as long as you're going to be around, and if not, if you could just maybe give us your email address, I will personally find that for you and send you a message. But I want to say no, but I don't want to say I'm 100% sure. So, you know, with the government, you just never know. There could be a penalty, you know, I'm just not 100% sure. So, but that is a great question. Thank you.
Perfect. Okay, and we just got another question from Peter, which I will go ahead and type because he said that he's not receiving audio in London, which we're glad to have folks from across the pond. But yes, for everyone who can hear us, this is being recorded and we will be posting it.
Okay, sorry he can't hear. Do you want me to try to call in, Jigger?
I don't think so. I think if most folks are able to hear, then we'll keep going just in the interest of time.
Okay, perfect.
We do have two other questions coming in from the chat though. One from Ruth. She was told that UV Remodulin is covered with Part B and then would need a Plan G to cover additional costs.
Okay, so I think there's some confusion with the Remodulin. I have not heard anywhere that the Remodulin will not be covered under Part B anymore. It should be. I think the confusion might be that the new Tyvaso has come out and it is no longer covered under Part B if you're getting the dry powder. And I don't know if that's the confusion with it, but I was not told by anybody that Remodulin, because it's still going to be a pump, I don't believe that it will not be covered under Part B. I am 99.9% sure that that's what it is, that there's some confusion because the new Tyvaso as it's come out has now come out in a dry powder. So it's no longer the inhaled machine that you use, the TP3000, I think it was called. And a lot of people are getting confused because it's now going through your Part D or your prescription plan. So as I said, I'm 99.9% sure, but I am going to actually call the manufacturer and find out, and I will get a definite response. But last I heard, it was still going to be covered under your Part B when I spoke with somebody from the manufacturer. But I will confirm that if she would like me to, because that is not something, you know, that I've heard. I mean, it's still going to be the same. Like I said, the Tyvaso now is under your prescription plan because it's not an actual pump anymore. It's just an inhaled thing. It looks like a little vape. If you know what a vape looks like, it's like a little square about this big, and it's only one breath 4 times a day, and it's dry powder. So I don't think that that's going to be the issue. But there might be some confusion between the two. I'm not really sure, but from what I know, it's not going to be. But I will definitely 100% confirm that with the manufacturer and find out what's going on.
Okay, and Ruth sent a follow-up comment about, since Remodulin is so expensive, I think she's wondering if there would be an additional amount that's not covered, that having a Plan G or the Medigap coverage would be needed, I think is the question.
Oh, okay. Well, I think what a lot of people are going to have to do, you know, it is going to be like an 80-20% coverage again. And, you know, I think that that's where you're going to go into the Medicare Advantage plan where you might get some additional insurance for it. And we are going to be talking more about that type of stuff in our next meeting. Like the next one, we're going to be talking more about deductibles and Medigap. So I really kind of don't want to get into it right now about the Medigap, but yes, I'm sorry, Ruth, I didn't understand the question. I think that there's going to be needs for grants and things like that for the additional insurance and how much it's going to cost. I definitely think that's going to be something that we're going to have to talk about in our next webinar a little bit more, if that's okay.
Okay, and I think while you were talking, it fixed itself, but you did fade out a little bit. So I think maybe if you stay close to the computer, that might hopefully help.
Okay. I'm pretty much as close as I can get, so.
Okay. Yeah, thanks.
Okay.
There is some additional questions. I think I am going to hold on to these, though, just so you can get through a little bit more of the presentation, and then we'll pause again for some more questions. But
okay,
really
great.
Appreciate everyone being so involved and asking all these questions. These are really good. Thank you, guys.
Yeah, they're excellent. Thank you so much, everybody. I appreciate that. Okay. So now we're just going to start talking about some terms and policies that Medicare has that can be very confusing. So drug formularies, also known as a formulary drug list. What does this mean and how does this affect you? So a formulary drug list is the list of covered drugs by the specific policy you are in. So you may have one policy and another patient that you speak to, whether it's in a group or you're in the office and you're talking to them and they're saying, oh, well, my tadalafil is covered. And you say, well, mine's not covered. It's very specific to each policy that you're in. So you want to make sure that you know what the drug formularies are. For a drug formulary, the plans cover both generic and brand name prescriptions, drugs. The formulary includes at least 2 drugs in the most common prescribed categories and classes. And it affects you because if your medication is not on the formulary list, your doctor's office must get a prior authorization for what's called a formulary exemption, which will take you longer to get your drug in the beginning. A preferred pharmacy. Medicare plans have contracts with pharmacies that are part of the plan's network, I say. This can change once the contract expires. So you may be with one pharmacy for 2-3 years, and then all of a sudden the contract might change and everything has to change to a different pharmacy. It's nothing that we as the doctor's office or you can do about. It's really just about the insurance companies and which contract they have. So unfortunately, that is something that does happen. And when it does, we just ask that you reach out to your doctor's office as quickly as possible. As soon as you find out if it's changing, you let us know. Also, just so you know, if you go to a pharmacy that isn't in your plan's network, your plan might not cover your drug. That's very important to know, so you want to make sure you're staying within your network or at your preferred pharmacy. I just really quickly want to go over the difference between a retail pharmacy and a specialty pharmacy. Retail pharmacies are for short-term illnesses. Like let's say you have strep throat and you need an antibiotic. That's when you would go to a retail pharmacy. However, with a specialty pharmacy, they work with patients and physicians to provide medication for chronic and more severe illnesses, such as PH. Your specialty pharmacies serve patients who require complex treatment therapies that require regimented medication protocols, they provide patients with more detailed education and patient care services that are required for their medications. Let's say you're on a prostacyclin. You may need nursing visits for training and education and weekly check-ins in the beginning. These are things only a specialty pharmacy can provide. Just saying this though, however, some of our generic medications are now being able to be filled at a retail pharmacy. So if it's generic, you may be able to get it at the retail pharmacy. So what happens if my medication is not available at the preferred specialty pharmacy that my insurance company is telling me I have to use? So some medications are what is called limited distribution, meaning only certain pharmacies can provide the medicine. If a medication requires a nursing visit, some of the smaller specialty pharmacies are not able to provide that service, so a different pharmacy must be used. Sometimes an insurance company will require an override for this, and again, this could delay the time it takes for you to get your medication for the first time, because we do have to go through the override process. The next one that we talk about, and I think this is probably the most common for everybody to have heard or hear, is a prior authorization. This means before the plan will cover a particular drug, you must demonstrate that you meet certain criteria for you to have that particular drug. Plans also do this to be sure these drugs are used correctly. Plans may also use prior authorization when they cover a medication for certain medical conditions, but not all medical conditions for which a drug is approved. The plan may want you to try one or two of the more formulary medications, which we just talked about. The physician's office can ask for an exemption type of PA if he or she believes the drug prescribed would be a better alternative for your condition. And I also just want you to know, this is very important, that no matter what plan you're on, if you are using your insurance, all of our pH medications need to have a prior authorization. You are not going to get it unless you have a prior authorization on file for the medication. It's always going to be asked for. Another term and/or policy is step therapy. Step therapy is a type of coverage rule, also known as fail first. In most cases, you must first try a certain, less expensive drug on the plan's formulary that's been proven effective for most people with your condition before you can move up a step, as they say, to a more expensive drug. For instance, some plans may require you first try a generic drug, if it's available, then a less expensive brand name drug on their drug list before you can get a similar, more expensive brand name drug. So, quantity limits. For safety and cost reasons, plans may limit the amount of prescription drugs they cover over a certain period of time. Some of our pH medications require your doctor's office to request a quantity limit PA. So, what would qualify as a quantity limit? So, a titration of medication. Most of our prostacyclins are titratable until you reach the maximum dose. So, you need larger quantities in the beginning until you reach your tolerable dose, your maximum dose, and that is going to require us to do a quantity limit prior authorization, or PA. Or let's say you have a higher dose is required but not available. So let's say you're on sildenafil and the doctor has you on 40 or 60 TID, meaning 3 times a day. That's not available, but where you would get a higher dose quantity, you'd get a quantity limit for the higher dose. You would get a prior authorization for that, but they are available if that strength is not available. So those were just some terms and policies of Medicare at this time that we wanted to go over. We're going to just take another quick pause here before we continue to see if we have any further questions. Jigger, do we have any more questions?
Yep, there are definitely some questions. So from before, we didn't get to Beth earlier. She had asked, her husband is going to be 65 this year, and she had waived beginning Medicare when she turned 65 so that she could stay on his insurance while he was working.
Okay.
So she's wanting to know when he turns 65, which will be next year in 2023, should she wait to enroll then, or should she be enrolling now during this 2022 open enrollment period?
Yeah, I would highly recommend going with the open enrollment. Yes, you can go to your 65, but did she say when she was turning 65, what month?
So I think she already is.
Okay, so she's 65, it's just him when he turns 65.
Mm-hmm.
I would highly recommend doing it now, and the only reason why is because it is such a higher, this is the best time to do it. It's a process, and you don't want to have any gap in between where you might have to pay for COBRA for a couple of months until it goes into effect. Especially if him or her, I don't know which one of them have the pH, but I would highly recommend doing it during the open enrollment because it is such a timely process. And again, I don't want them getting stuck with any kind of COBRA during the time period from the time they turn 65 to the time that the actual Medicare goes into effect. I would say probably my best experience would be for them to start it now during the open enrollment time period so that it starts as of January 1st regardless, even if he is still insured, because if he decides to keep it, if he's still getting the insurance through his company, it's just going to be like secondary insurance. His Medicare will be secondary, and he would probably get a little bit more coverage then, because whatever his commercial insurance that he's getting through his through his employer, will cover most of it, and then Medicare can pick up the rest. So I would suggest that he do it during open enrollment.
Okay, great. Thank you.
You're welcome.
And then there's a question, I guess maybe more of a comment from Rita, who said some Advantage plans refund the amount for Part B. I think she means for the premium. For the premium,
sure. Okay. I'm not aware of that. I don't know all of the Advantage plans, but that's wonderful, Rita, if that's true. I guess that would definitely be something that we can add to the reason why you might want to go with a Advantage plan versus a Medicare Part D. That's wonderful. I mean, if they do that, that would be great.
Yeah, definitely we'll want to look into that and see if there's some guidance we can provide for folks.
Yeah, definitely.
And then it looks like Jana is commenting, I think this might be in relation to Beth's question. She brought up that there's kind of a personalized open enrollment moment that you get if you have a life-changing event like losing employer coverage.
Yeah, no, there definitely is. But what I was trying to say was that because I know there's some time in between when you get it enrolled and you don't have, there's sometimes you have to wait a month. Although it's proactive, with PH, you might get a bill if your insurance didn't cover like a Tyvaso, and you get a $3,000 bill, and that just adds stress to your experience. So, and if he's not paying for his commercial insurance through his employer, or if it's just if they're able to keep it, I would highly recommend doing that. But I think that's really a personal choice. I personally feel like it would be the best it would be to do it during open enrollment. But I agree that yes, they do that when you have like a birth or an adoption or getting married. Yes, they do have a small period of time where you can do that too. So I think it's really just up to them what they decide they want to do. But thank you for that information, for sure.
Perfect. And then Diane, I think, is chiming in on the Medicare Part B reimbursement. She mentioned that reimbursement depends on the area you live in and the Advantage plan you get. So it sounds like there might be some folks who are able to get it, but maybe it's not available nationwide.
Okay. Well, I mean, Jager, let's definitely write that one down, because I said, I hadn't heard about it. So I would love to do a little research into that and see for my own patients too, or for people that are not able to come to this. I think that would be a great thing for us to look into. So thank you for telling us about that it could not be national.
Yeah, definitely. Really appreciate this. And this is exactly why we love to have these events and programs, so that we can have, community knowledge sharing, because it's not all about the one expert and, then everyone else. We all have experiences and knowledge. So really appreciate that, everybody.
Absolutely. I feel like sometimes my patients have more knowledge than I do.
Yeah. All right, we've got a couple more questions, and then I'll let you keep moving on. I did also want to pause just for a moment to let everyone know Angela was kind enough to post the links to the websites where the webinars are going to be uploaded. They are not uploaded yet, but we will be putting them up on PHA Classroom, and then also in the insurance and treatment access section of the website. And then in addition to that, we are going to also email the links to everyone who's registered for these webinars. So everyone will be getting links to those recordings once we have them uploaded.
Oh, that's great. Thank you,
Angela. Okay, so then we have another question from Ruth. Actually, two questions. So first, she's asking, how do you find out if the plan that you chose is going to cover your specialty pharmacy, which I think, if you haven't already, you do get into that soon. So I think that question is going to be answered. And then her other question was, if you use IV Remodulin that's covered on Part B, then would you be able to use an Advantage plan and especially if you need to use the Plan G Medigap part.
Yes, absolutely. You could definitely use the supplement, the Medicare Advantage plan for it. I think that Medicare Advantage is kind of it's kind of replacing Medigap, is what they used to call it, because as I said before, what does Medicare Advantage cover? It does cover the 20% also. So it helps you to pay for that gap that you have, if you're not getting funding through grants, or if you're not getting assistance from somebody else. That will definitely help. The Medicare Advantage definitely helps you to pay for the gap, as they call it, the Medigap. And again, we'll talk about that more in the next webinar. We talk more about Medicare Advantage and Medigap and all the little things that you need to know. But yes, absolutely, that would be one that she could use and would help with her Remodulin copays for sure.
Okay, awesome. And then we just had 2 other questions come in. Carla is asking about if there is a donut hole on Part C. So we were definitely going to get into the details of donut holes and everything next week. So I think we'll hold on to that question to address it next week.
Yeah, for sure. Donut hole is the big question, I think.
Yeah, definitely.
Yeah, we're definitely going to go into donut hole a lot more next week, so for sure.
And Jerry has asked, he's been advised by SHIP, which I think is that like state help insurance, I forget the acronym, but a state-based insurance organization representative, advising him not to enroll, or sorry, I don't want to assume gender, but advising Jerry not to enroll in an Advantage plan due to being under the care of multiple physicians. So that would be, yeah, if that's which I think was probably going to be the case for quite a few PH patients.
Yeah. Yeah, that one has me a little stumped. I've never heard that. I mean, even if you're just with a regular insurance company, you're going to see more than one physician, especially Medicare Advantage is made specifically for, well, it's not specifically made for, but, the whole point of Medicare Advantage is that it helps you, you're paying the extra money because you need the assistance for the additional charges that you're going to have from Medicare A and Part B. That helps you. So I don't understand why they would say that. I don't know if maybe they just don't understand if Jerry has PH and they just think that it's just going to be a lot of different doctors. I'm not really sure. But I don't understand why they would have said that to him, because yes, you're going to be seeing numerous doctors, but most individuals that are in Medicare see multiple doctors. So
yeah,
I'm sorry, but that one just confuses me a little bit. And I would definitely want to find out more information as to why they're saying that, because I don't know. I mean, I know I have more than one physician, and I don't have a specialty. I don't have a specialty pharmacy, and I have numerous doctors that I see. So I don't understand why they would say that. So I'm a little confused as to why they would say that to them. But perhaps they're just trying to get them to do a program that they want him to be in. And I hate to say that, but I don't think, Jerry, that that's really necessarily the truth. And I think that maybe you should, when you're doing some investigating into your Medicare Advantage plan, if that's what you so choose to do, I feel like you should probably, I'm sorry, I got to work from my computer. I feel like you should definitely find that out and advocate for yourself. Ask, look around, speak to different Medicare Advantage plans and say, I was told by SHIP that I shouldn't because you're not going to cover my doctors. Is that true? Get everything in writing, get all your information. Write down who you spoke with, what information they gave you. Get it in writing if you can, that you have doctors, numerous doctors that you're going to be seeing, and they're going to be covered. It could possibly be that the doctor isn't in the Medicare plan. That's a possibility. You want to make sure that your doctor is in the plan and they're covered. 99.9% of our doctors do have Medicare. They do, most of the hospitals and such do take Medicare, so I don't really understand why they would say that to you. I'm sorry. I don't have a better answer for that.
Okay, and I do see Carla has chimed in that, like Jerry, Carla has actually been told something similar. And she says she's got 20 plus doctors. So I think maybe that's something, Danielle, you and I can look into this week and try to develop a better answer of why or under what circumstances maybe having an Advantage plan might not work out as well.
Sure. Yeah, absolutely. Let's definitely do that. I'm very sorry I don't have a better answer for everybody than that. But yes, we'll definitely do some research into that for you.
And then there are a couple more questions, but I think, again, in the interest of time, I'll let you get through the next section, and then we'll deal with all the rest of the questions once we've wrapped up the presentation.
Sounds great. All right. Thank you. Okay, thanks, everybody. So it's funny that we said that, because now the next thing I wanted to talk to you about briefly was to discuss the questions: should you choose a Medicare Part D or Medicare Advantage plan? The first thing I want you all to look at when you're looking into this is your cost. You know, consider the cost of both plans. Look at your total yearly costs, what your doctor visit copays are going to be, what your medication copays, your premiums are going to be, etc. And if you want that extra option of vision or dental that they may give you, make that all a big part of your decision. Look at the drug formulary like we talked about prior. Make sure whichever plan you choose at least will accept one of your drugs or the class of drug your medication is in, so the doctor's office can do a prior authorization for you. And then also speak to other patients and see what they have and what works for them. I cannot say it enough. Advocate for yourself and do your homework. Do what feels right for you and what you can afford. Some people might not be able to afford the Medicare Advantage program and plan, and that's fine. And if we find out later that after Jigger and I do some more research, we find that sometimes Medicare Advantage might not work for some people, you know, we'll look into that a little bit more too, and we'll find out maybe that's going to be a big part of your decision of which one to take. And I just really wanted to talk, and I'm just gonna leave this up here for just a minute too, because there's so many great websites on here, but resources. There are so many resources out there for you. PHA alone has a wonderful resource, which is called the Treatment Access Program. Reach out to them, reach out to this program. They may not have an answer for you right away, like Jake and I don't have some, you know, we don't have all the answers, but they have the resources to get the answers to you quickly enough. So reach out to them. There are other online resources that you can go to. You can go to Medicare.gov, Medicare Rights Center, which is the MedicareRights.org. These are all great online resources for you to look up and do some of the homework yourself and see what you can find out. If you're not computer savvy, have somebody in your life that does, that you can maybe just ask them for a little bit of help. And insurance can be so overwhelming and confusing. Please, 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 I can't stress this enough. Reach out for help. Don't try to do this alone. There's patient support groups out there. There are support groups that you can find. PHA has over 200 support groups nationally in virtual and hybrid forms, meaning you can do it online or you can do it in person, whichever you prefer. Some manufacturers have some support groups with patients. You just need to ask if they have a support program. They do. Some of them have ones where you can call somebody personally and speak to them and ask them about PH and ask them about their insurance. They do have plans or programs where you can speak to another patient and they're willing to speak with you to give you some support. And of course, if you are in a support group, you can ask each other about their experiences while you're exploring Medicare. There's so many options out there, and yes, we're one of them. I'm one of them, you know, PHA is one of them, but ask other people that are already starting this process. That's what we're all here for, is just to help you out. So just a brief reminder of all the parts of Medicare. Part A is for hospital, Part B is for your doctor visits, etc. The Medicare Advantage plan, which was Part C, is an all-in-one plan that you need to enroll in separately and may include a monthly supplement or premium cost. And Part D is for prescriptions, and you do need to enroll separately, and they also include a monthly premium to pay. In conclusion, I just want to say, choose what is right for you. Make sure you do your homework. Please ask for help. It's out there. And of course, advocate for yourself. You are not in this alone. Please make sure that everyone else is doing all they can to make this easier for you. Speak to your doctor's office. Go to the support groups. Talk to the manufacturers. We are all here to help you. Just ask for it, please. I just want to personally thank Janssen Pharmaceuticals for making this webinar available. It's great that we can do this, and we appreciate their support for these webinars. And personally, I just want to say thank you for giving me this opportunity to give you a little insight into this crazy world of Medicare. I know it's confusing. It has been my pleasure to talk to you all, and I truly hope that you can take at least one thing from this presentation. So now I'm just going to pass it back to Jager, and they are going to go over any further questions that we have gotten. So thank you all very, very much from the bottom of my heart. I do appreciate it. And Jager, you want to take it over, and we can just talk about whatever other questions came in during this time.
Absolutely. Yep. So I'll go ahead and start on some of the pending Q&A questions. So Joanne had mentioned, and this one is from a little bit earlier in the presentation,
Okay.
but Joanne mentioned she's going to be enrolling in Medicare in 2023,
Okay.
and is talking about the old Tyvaso. I think she's asking if it's still covered under Part B. And she said that she hasn't converted to the new version of Tyvaso for this reason. Or I guess, okay, so now I understand. She is currently using the old Tyvaso because it's still covered under Part B, and hasn't switched to the new Tyvaso because she's concerned about it being covered.
Okay, absolutely. Yeah, Joanne, yes, that's a great, great question. Thank you so much. Yes, the old version, or the nebulizer pump, definitely is still covered under Part B. It's going to continue being covered under Part B. The dry powder is not for everybody. Some people don't want to change. They're happy, if it works, don't fix it. So absolutely, it is still considered to be paid for through Part B. It's just a choice. If you choose to go with the inhalation, the dry powder inhalation, then yes, no, it will change over to the Part D or your prescription plan. So if you decide to stay with Part B with the inhalation, or excuse me, yes, with the inhalation system, the nebulizer, it will still continue to be covered under Part B. Absolutely. Long story cut down. Sorry about that.
Awesome. Thank you, Danielle.
You're welcome.
All right, so then next we have from Carla. I think this might be more of a comment or sharing with folks. She's saying if you receive assistance for premiums, you can change every month regardless of open enrollment, that she has premium assistance. And so she's able to change, which I think she's talking about like maybe joining or changing plans within, like, outside of the open enrollment period.
Okay. Yeah, I don't know anything about premium assistance. I just actually wrote it down because I want to look into that a little bit more. I'm curious to find out. I don't know if that's part of the Advantage plan that she's talking about, or, but I definitely want to look into that because that would be very helpful, I'm sure, for many people.
Yeah, definitely. Yeah, we will check into that. And Carla, if you want to pop in a little bit of extra background on what you're talking about, we would be very interested to know, what your experience is like there. So yeah,
Sure.
thank you for sharing that. Next we have from Jana. Jana is asking, do Medicare Advantage plans typically have a smaller provider network than straight Medicare, or I think like original Medicare, with a supplement, which I think the supplement she might be meaning the Medigap
Sure.
coverage?
Again, that's a great question, and that's definitely one we're going to have to look into, because I think that kind of goes back to the question about the 20 different doctors that
yeah,
I forgot their names, and I apologize. But I think that's definitely might be why they're saying SHIP is saying that, and the other person that said that made that comment. So I definitely think that's going to be something we're going to have to look into if it's because some of the Advantage plans are some of the smaller insurance companies, so maybe that's why, because they're private, they can then say, I'm not going to cover this person. What I do know, because we are such a specialty, you know, where it's the disease that we are, there's not a lot of doctors out there that can provide care for you if you're a PH patient. So it might take a little bit longer for you to be able to see the doctor that you want to see, or they might predetermine who you can see. Like, let's say there's a PH doctor in your town, but you want to go to a bigger one someplace else, they might say no. So that's what I'm wondering. So let's definitely, Jigger, I really feel like we should, you know, I feel like I should have done more homework on that. I apologize, but I think that.
Well, I think that's exactly why we're having both of these presentations, so we can get kind of the baseline stuff, and then that's generating all these great questions that everyone is asking.
No, that's an excellent question.
We love that. And so we'll, you know, try to come back next week with some more answers.
Yeah, for sure, for sure.
All right, and then Joanne, who had asked about Tyvaso, said that she does still have some questions regarding the Tyvaso pump, the coverage under Medicare as she's enrolling next year. So yeah, Joanne, if you want to type in some specific questions, and I don't know that we'll necessarily be able to answer them right away, but again, we'll try to do some research and make sure that we have an answer for you next week.
Yeah, for sure.
And then Kelly is saying, hello, here in Wisconsin, they have Medicare Part A, B, D, and then can add a supplemental Medigap plan that covers the 20% that Medicare doesn't cover. And if you do not go with those options, then you can go with a Medicare Advantage plan that includes A, B, and most of them have Part D. Medicare Advantage, depending on what plans you have, might limit your choice of doctor. Kelly, that is such a great summary of what we've just been talking about. You said that so succinctly. That's wonderful. Thank you.
Yes, thank you, Kelly. Much better than I did. I tend to ramble, sorry.
Yeah, so I think that's a really great summary of kind of what we're dealing with of the original Medicare has those parts A and B and D, and then some folks go with the supplemental Medigap to cover that extra percentage that Medicare doesn't cover. And I think it, you know, as folks have been talking about, it depends on where you live. But if you do have limited doctors and limited network, then I think maybe in those cases, it could be when Medicare Advantage is less helpful.
Absolutely.
So we'll do some more digging to confirm that answer. But yeah, that's a great summary. Thank you, Kelly. All right, so our next question is coming from Rita. Actually, this is an FYI. So Rita mentions there's a Medicare and You booklet, and there's on the back page, there's the number for SHINE, S-H-I-N-E. This is a group of volunteers who have been trained on Medicare. They can work with you on the phone or in person. It's a free service. Rita, that is an amazing resource. Thank you so much. I had not heard about that, but that's great to know. I'm going to look into that, and yeah, that we should actually have that on our help page. So really appreciate you sharing that. All right, so then next we have another comment from Carla. So with the premium assistance, so she's clarifying about the premium assistance that she mentioned earlier, that you can move to or from Advantage plans or different drug plans regardless of open enrollment time frame. Okay, really appreciate the clarification there, Carla. That's actually interesting. I know I had heard about with Medicare Advantage that there's a 3-month period where you can switch between plans from January to March. So that's really interesting that you maybe have had more flexibility. That'd be great to know if that is the case. But yeah, I appreciate you giving that clarification. And then I see in the chat, Ruth actually just asked for Shine's phone number. So Rita, if you're able to pop that in, that'd be great. Otherwise, I'm happy to look that up and provide it to everyone next week. So either way. All right, and then from Joanne, she's given a little bit more clarification about that Tyvaso question. So she says right now she has Blue Care Network and Tyvaso is covered under her prescription coverage. She has also seen Tyvaso listed in some of the formularies for Medicare, both the online and hard copy booklets of formularies. So I guess she's trying to figure out where Tyvaso fits in those formularies.
Sure.
Oh, and then there's a follow-up. She is hoping that Tyvaso and pump is covered under Part B, as one could reach catastrophic with the first prescription in that case.
Absolutely. Yeah. No, definitely. It should. It should. It will be covered by Part B, and it should definitely hit the catastrophic point by the time you get your first delivery in January. Mm-hmm.
Okay.
And yeah, like I said, we'll talk about the catastrophic and the donut hole next week, but yeah, for sure, Joanne, it will. And as I said, if you're using the nebulizer, it's definitely going to be covered under Part B.
Awesome. All right. Thank you for that. And then let's see, we've got just a couple of comments, I think, left from Diane. Diane was mentioning when we were talking about having multiple doctors about the in-network, and that if you have 20 doctors, odds are that not all of them are going to be in-network. I think that's a really good point. And yeah, that's probably what you would potentially run into trouble with the Medicare Advantage. And then Diane also chimed in on the comment about having Part A, B, and D versus going with Medicare Advantage. Diane is saying, I think Wisconsin and Massachusetts have different rules. So that's a great tip. That'll be maybe a starting place for Danielle and I to look into these different locations and where things might differ. Because yeah, I think that's a good thing to know, that it's not necessarily going to be the same experience for everyone across the country.
Yeah, for sure. I'm just writing all that down so I just remember.
Yeah, and I'm actually copying down everyone's questions, so Danielle, you and I can review them and make sure that we're addressing everything thoroughly.
Yeah, for sure.
Okay, well, we are getting close to the end of the hour. That looks like that's mostly all the questions that have come through. Let me double check the chat and see if I've missed anything. Okay, so there is a comment from Holly. Holly mentions benefit verification for all meds can take time with any insurance change. That's a great point. I think that's actually something that Danielle is going to get into a little bit in more detail next week. But yeah, Holly, great point. That's something that folks need to make sure they're counting on it taking time and giving yourself that cushion of time and not trying to do stuff last minute. All right, so we've got one more question here. This person says they have Medicare Part A and B and supplemental insurance with Blue Cross Blue Shield and a prescription drug plan. They're in North Carolina and were diagnosed 6 years ago. They had received full coverage for their drugs, which was $12,000 per year through assistance programs. They're saying there are a few of them now and last year. So I don't know if I'm necessarily seeing a question here, but I really appreciate you sharing your experience. And I can definitely confirm, because I'm kind of the main person who's been running the treatment access program for PHA for going on 2 years now. I started last April, and absolutely, you're 100% right. There are fewer programs that have been open in the last 2 years. Or now in last year, the year and a half, whatever. It's been pretty scarce.
Yes.
So I know recently the assistance fund was open again. I know they've come open and closed probably half a dozen times, it seems like, this year. So
I think they actually just closed again. I think the
okay.
PH part of it just did close again recently.
Yeah.
But yeah, they're pretty consistent with opening up and closing again.
Yeah.
More than the others. The other ones usually just open up and then close, and then they're closed for a while. But
Yeah.
the assistance fund does tend to. But again, that's something we're definitely going over all of the assistance programs next week, and we can talk about all those things. But yeah, it can be. It's a lot. It's a lot. Medicare is just. It's so much, and like I said, I've been doing this for 8 years, and I'm still learning. So, just the help is out there. We just have to try to find it for each other.
Yep. All right. So last couple of comments here. Diane added, so she believes Shine is actually maybe specific for Florida only, but she points out that SHIP is nationwide. So I think there's like a state like division of SHIP for all 50 states, basically. And she has shared the phone number for SHIP in the Q&A. So I'm going to go ahead and copy that phone number and put it in the chat as well. Or I will attempt to, at least. Okay, there we go. Awesome. Thank you for that, Diane. And then lastly, Carla has asked, where do we send questions about next week's subject? Thank you for that question. So if you wanted to submit some questions, you can absolutely send them to me if you want to use the insurance@phassociation.org. That would be great. So I'll go ahead and type that email in here as well. Or Angela also mentions PHA webinars. You can also submit it there. So I'll go ahead and put the insurance one in. That one honestly is great for any treatment access questions. The insurance alias goes right to my inbox, so I'll see it as soon as you email it out. And I'm happy to take on any insurance questions that you have and try to figure out an answer for y'all. So yeah, I think that looks like it's about it. Really appreciate all the engagement, everyone, and thank you for your patience as we get to all these questions. So we will look forward to seeing you all back next week and having some more answers for everyone.
Yes, thank you so much, everybody. I appreciate it. Have a good day.
Bye, everybody.